Hello everyone, welcome back to my channel. And today is Sunday, and being Sunday, it means we are back with another episode. Now today's video, this is a warning, is going to be quite longer than other videos that I've been making, because we are talking about something that is very important, that needs us to review some studies together, to have a conclusion together. So today we're going to look at the castor seeds. A few days back I had a client here, and we were discussing about family planning, and then she posed the question that made me think. She was like, "Doctor, what is your take on the use of castor seeds as a contraceptive?" And the truth be said, I did not have enough information about it, and that's the response that I gave her. Today in this video, I want us to discuss together, to review together, and then to come to a conclusion together on whether we can actually use castor seeds as a contraceptive, on whether we can recommend the use of castor seeds, and what evidence is there about use of castor seeds, what is the effectiveness, what is the side effect profile, and everything. Thank you very much for tuning in. Please remember to subscribe, like this video, share the channel, and always come back. Turn on that notification button. Every Thursday and every Sunday, you will be getting a video. So we are going to look at basically 4 studies, and in order to be brief, I'm going to be picking out only the key findings. So the first study that we're looking at here is from ResearchGate. It's looking basically on the contraceptive effect of the castor beans, which was published in 2008. So what they did here is they got rabbits, and they treated them with castor bean seeds at a level of 7.5 milligrams per kilogram body weight daily for at least 10 consecutive days. And then they mated these rabbits with the male rabbits. The treated and the untreated, or the control group, were actually inspected or monitored for pregnancy, body weight, and apparent side effects. And these were the results. So the treatment, or those rabbits that received the castor seeds, actually resulted in a 4.3-fold decrease in pregnancy of the treated female rabbits as compared to the untreated control group. Okay, and then what was observed also is that there was some bit of transient diarrhea as a side effect and loss of body weight. Another key finding here is that the inhibitory effect of the castor beans on pregnancy was reversible. So what they observed is that at least some of these rabbits that did not conceive, they remitted at least 4 of them, and then of those 4, at least 3 of them became pregnant and delivered at term. So this is the same study that we've looked at, only this is the full study. The other one was an abstract. So the treated animals were 21, and the control group also had 21. So of those that were treated, out of the 21, only 4 became pregnant. On the other hand, of those that were in the control group who did not receive the castor seeds, 17 of them became pregnant. Another study that we want us to look at was investigating basically contraceptive efficacy and chemical pathological effects of the castor seeds on volunteer women. So what happened here is that 50 women who were volunteers were given a single dose of 2.5 grams once per 12 months of these seeds, and they were actually protected against pregnancy for a period of 1 year. Okay, and the side effects were actually very minimal as per this study. The renal and liver functions were not affected. The third study that I want us to look at actually was conducted also in Nigeria among the volunteer women. And what happened here is they gave a single dose of 2.5 to 2.7 grams to these volunteer women. And then they were basically investigating the possible hormonal changes, also looking at some of the effects or the changes that might take place on the cervix of these women. Those who were in the treatment group were protected against contraception for 12 months while maintaining regular normal cycle. Also, the side effects were there, but they were very minimal. The hormonal changes, yes, there was some bit of changes on the prolactin. For those who know a little bit of medicine, you know what prolactin does. However, there was no change in the follicle-stimulating hormone and luteinizing hormone between the two groups, and also there were no changes when it came to the cervix. The fourth study actually is actually an interesting one, because it brings in the male aspect. Okay, so it was also looking at the castor seeds. Actually, we call it listeners communis in the scientific term. So it was looking at the male contraceptive effect of these seeds, and they used rats in this study. They got 30 rats that were put in the treatment group. Also, they got the control group. So in the treatment group, they gave them castor seed extracts. They collected semen at 72 hours and 6 weeks after treatment for follow-up and analysis. And what was very key was the seed extract suppressed spermatogenesis and sperm motility up to 6 weeks after treatment. What this means is the production of sperms and their ability to move was actually affected for 6 weeks or up to 6 weeks from the day of treatment. However, these semen parameters reverted back to normal within 7 weeks of treatment. Okay, so the conclusion here was, can we think of castor seeds as a possible male contraceptive agent that can relieve women of their reproductive burden globally? That's a question for you and me to think about. And then lastly, going back to one of the studies that we've seen, there's something I want us to look at. This is the discussion on that first study that I showed you where they used rabbits. So this was the discussion of the authors. The authors here are saying, although the use of castor beans as a contraceptive in women has been reported, scientific confirmation of such practice is not yet available. Okay, it is worth mentioning that ingestion of castor seeds, if thoroughly chewed, causes burning sensation in the mouth, followed by nausea, vomiting, abdominal pain, extreme thirst, and body diarrhea, prostration, headache, weight loss, dullness of vision, depression, low blood pressure, and circulatory collapse. So after those studies, we've seen that castor seeds actually have an effect on contraception or on fertility, and they actually provide the contraceptive effects. The question here is, are they recommended to be used as a family planning method or for contraception? Can I prescribe it for someone? The answer is, personally, right now, I do not recommend using castor seeds as a family planning method, because like you've seen as towards the end, there is actually no scientific evidence of their mechanism of action. All the studies that we've looked at, yes, they show that there is actually an effect on contraception or on fertility, but they do not provide an accurate mechanism of action. And also their use in human beings, the studies that are available are actually very, very limited to prove the safety of using them, and also their efficiency or effectiveness. So in case someone is actually using castor seeds as a contraception, yes, you're doing that, and that's okay if it works for you. I don't know, personally, I would not really recommend it because I do not have that scientific evidence that it actually works. But also we have to look at the side effect profile. When you Google about castor seeds, just put in Google, you actually find out that there is that bit of toxicity which is in there. And most times people even remove the outer covering because it is toxic and it can have really undesired effects. So the question is, should we really go on to use castor seeds as contraception? And my answer here would be, we need further studies to actually evaluate this and be able to come up with clear guidelines on how this can be used as a contraception. But I do believe it is really a promising discovery that has been there for very many years and centuries. I don't know why it is not yet being used. But also, when you look at the male side, it is actually something that might really, lift the weight of the women in case we actually investigate further on how these castor seeds can be used as a contraception among the men. So, I don't know, what do you think? Should we continue with the castor seeds? What do you think about this entire use of castor seeds as contraceptive? Let me know what you think in the comment section, and see you in the next video. Bye-bye.